San Diego 6 News in the morning. Your station for balanced news.
Well, for many Americans battling obesity, the lap band has been a lifesaver. Now the FDA has expanded the availability of the band for people with lower weight issues. Dr. Julie Ellner explains why this loosening of the guidelines is good news for some, but not a pat solution for all. Thanks for joining us this morning, Doctor.
Thanks for having me.
And we also have one of your patients here, Autumn. Thanks for being on board as well.
Thank you.
Doctor, tell me, first of all, what you think about this expansion for the lower body weight index for these people.
I think it's wonderful news. It will affect tens of thousands of people in San Diego. The FDA announcement came out as a result of 20 years of research that has proven that surgery is really the only effective tool in the long run for keeping off serious amounts of weight.
This isn't a solution for everybody across the board, though, you were saying.
That's right. It's very important for patients to understand that there are different surgeries, different options, and it's important for patients to go to a consultation with a surgeon that can offer different options to the patient.
Tell us how it works.
The band itself is like an inflatable inner tube. It wraps around the top part of the stomach, and it's attached through this little tubing to a port. This part is buried under the patient's skin, and I go in with a needle through the skin, just like getting blood drawn, and either squirt in or remove saline that fills into the band and squeezes it down. So when people eat, it fills up this little tiny golf ball sized stomach, and they feel very full on a small amount of food. So the beauty of the band is that the patient and the surgeon take complete control of the pace of the patient's weight loss by either tightening or loosening, adjusting and fine-tuning the band as the months pass.
Oh, wow. So that's great. I thought it was a permanent size and you were stuck with that.
No.
Now, Autumn, how's it worked for you?
It's great. I'm down 137 pounds in a little over a year. So it's been wonderful experience. Just having a surgeon that works with you every single month, I think, contributes to my success too.
And the doctor was saying that, you know, this is a solution for people who really there was no other solution. That was your case.
Yep, I had tried for years and years prior to visiting Dr. Ellner, and at that point, having a 3-year-old and not being able to do anything with her, it was the end result.
I imagine it's changed your life.
Yeah, just a little bit. 37 pounds. It's great success, and I love it. I feel so much better. You know, I run, I work out, I'm really active. You know, I love to kayak now, so I do things to role model for my daughter that I never would have before prior to the surgery.
Real quick, doctor, just tell me how they've expanded. What's the difference between the old guidelines and the new then?
They've lowered the BMI requirement from 35 to 30, and that for most people calculates out to maybe 10 or 15 pounds less that would qualify them for surgery. So the idea is to get to people earlier. Earlier intervention is the key to potentially avoiding an early death due to obesity.
Both of you, thanks so much for joining us this morning. Some great information. It sounds like some great news for a lot of people who are considering this out there. All right, take care. And for more information, go to san diego6.com and just click on Hot Topics.